So thank you for being here, Ashley and Natalie, as part of the Precision Medicine Awareness Month speaker series. And today we're going to be talking about data sharing and AI, which is one of the themes that came up with the Planning Committee for Precision Medicine Awareness Month as one of the key messages we wanted to talk about. I think for myself, especially, I think the data sharing I can understand, but the AI is still a little more complex for me. And I had a really great conversation with Dr. Alexandra Greenhill on AI. And so I'm really looking forward to the discussion we're going to have today. But I'll just introduce you quickly, Ashley Girgis and Natalie Szudy from the Terry Fox Research Institute and their digital health and discovery platform. And so thank you for taking the time and for sharing your knowledge with us.
Oh, that's great. Thank you so much. We're thrilled to be here. Yeah.
Yeah, thank you.
I'm thrilled to have you both here. This is very exciting.
Great. So I think we had some slides. Absolutely. Yep. So we're just going to put them up on the screen. And it's really great to be able to connect today to talk about the work that we're doing through the Digital Health and Discovery platform. And I think your point around the integration of a technology to help support AI applications, specifically around precision medicine, is really important point of conversation because we're seeing a lot of innovations within this area. And we've had the opportunity to work within our network, and we'll explain it a little bit as we move forward, but around not only a technology that will help enable this work, but then also with different individuals involved in the space with the AI institutes across the country, data scientists and researchers and clinicians, but then also patient partners that are really interested in this space and helping to support the initiative. So I'll start just quickly with a little introduction about myself. So I am the managing director for the Digital Health and Discovery platform, and I have a lot of experience in supporting human-centered healthcare innovations. And I've had experience working with pan-Canadian networks that look at connecting patients, clinical research, industry, and technology partners together and supporting innovations that really ultimately help support precision medicine. And I'll let Ashley introduce herself.
Thanks, Natalie. Just a quick comment to you, Sabrina, but I like to tell people in general that you know more about AI than you think because it's a growing field and there's a subset within a subset. So I truly don't believe that anyone can be an expert in AI, but a specialty in AI. So I just wanted to throw that out there. So just diving into a brief intro about me. I'm the program manager for the Digital Health and Discovery platform. And I originally got interested in the health informatics field back during my undergraduate studies when I started to do computer science courses just in my second or third year. And during this time, I also gained some experience with real world data. So this is a very common term you hear in this type of space, and have experience working at different types of institutions like research, hospitals, and business environments. And I really am just interested in learning and how to implement the new technologies in the healthcare area effectively, because I've seen time and time again there are extreme complexities and limitations to the implementation, but that's the beauty in the implementation because we get to overcome these challenges and learn how to share data and collaborate. And without further ado, I'll pass it back to you, Natalie.
Sounds great. Thank you so much, Ashley. And so on the next slide, we'll talk about really our DHDP mission and what is the Digital Health and Discovery. And I will put out a disclaimer, please jump in if I've used an acronym that doesn't make sense in the conversation. I can quickly clarify because we do love speaking in our acronyms. And so I'll do my best to make sure that that's not the case for today's conversation. But so what is the Digital Health and Discovery Platform, or the DHDP? And it is a made in Canada digital platform that enables data sharing to accelerate precision medicine for all Canadians. And so that's through being able to leverage the data that exists across the country that has been collected through research or clinical systems, and to support the development and use of AI modeling, and to really move forward with precision medicine applications. So as part of this platform and this initiative, and we are funded by the Innovation, Science and Economic Development Canada, or also known as ISED, to help in the development of this platform. But there's also a need to develop policy and federated data governance policy frameworks that are in place that work hand in hand with the platform in order for data providers or data custodians to use the technology effectively, and to allow for the sharing of data across the country to approved users. And what this does at the heart of this is promoting a development of this innovation ecosystem. So we're able to support through the platform groups coming together to collaborate in order to work on the development of a predictive modeling tool, for example, that can leverage the data that exists across the country. One point of information that you're probably very familiar with, and many people from an understanding of what's required for artificial intelligence, is you do need quite a bit of data in order to develop the model. And that data does exist across the country, but there's big challenges with being able to share data provincially, even within some provinces. That's a challenge. And so what we've been tasked with, and what our initiative does, is allows for data sharing to happen without actually sending the data away from the institution. And that's the innovation piece to the platform itself. And that's definitely one of the pieces that I would speak on behalf of the DHDP team that has brought us all together to collaborate and work on this initiative. So from a systems lens, I can talk a little bit more about the DHDP. The next slide, please. So in the previous slide, I talked about the relationship between technology and policy innovations. Another piece that I want to talk about is the creation of what we call a network effect. So this is where we have individuals that are our patient partners, clinicians, researchers, industry partners, that are all being able to collaborate around the use of the platform itself. And that is what we also have identified as a key way to accelerate innovation. I talked about some of our partners, and that includes working with the AI institutes across the country. So as part of our network, we also are working with Mila, Vector, and Amy to support collaborations within the AI institutes and the use of the platform. Another key piece is we want to mobilize Canada's knowledge economy and to help develop the use of AI for healthcare innovation. And I think that this is an important piece too. And this is where we see the technology being that key connector that brings together the network of the DHDP. I will also say that one of the pieces of information around that we share for the platform is that although we have primary areas that we're currently working in to support, so that's within oncology and neuroscience, we also talk about the fact that the technology itself can be considered disease as agnostic. So once we're able to share data within oncology and in neuroscience, we are able to support data sharing across other data points and bringing together other networks that are working in different diseases. And what that also will do is that will help create a more fulsome picture of data around a patient case, for example, and really help to round out models that are being developed from an AI perspective. Next slide, please. So I talked about the mission to bring precision medicine and personalized care in cancer and neurodegenerative disease to Canadians. And I've also talked a little bit about the federated distribution, meaning, and that's a very technical word that we use a lot when we're engaging with individuals around the fact that the data will stay where the data was collected. So if you are a part of a research study and you've contributed data to that research study at a hospital or in an academic institution, and your data is within their systems, the platform will connect to that data without the data leaving the firewalls of those systems. That's a really important point when we've been talking with our stakeholders at academic institutions or clinical settings, because that really helps enable ensuring security and privacy, which are key components to being able to leverage the use of AI. And I also talked about our support through the Strategic Innovation Fund from the Innovation, Science and Economic Development Canada, which is the ministry that supports our work. So you'll see it in our next slide here around the strategic lens, that the DHDP really brings together collaboration, but also to solve a little bit of what we call the elephant in the room. So we've used this to describe understandings around data sharing and what that means for connection within AI. And some of you might be familiar already with this story of the blind man and the elephant. But essentially what it's illustrating is that you have different people that come together that are blindfolded, and they're around an elephant, and based on what they're touching, they have different understandings of what it is. So for example, the individual standing on the ladder is touching the body of the animal, the elephant, and says it's a wall. You have an individual at the front touching the tusks and saying it's a spear, and somebody at the feet saying it's a snake. And everybody that has their own sort of understanding or perspective to what the work that's being done or the problem or the challenge is, bringing that very specific perspective. And when we talk about developing a federated technology or a platform to support federated learning and how that would help move forward goals around precision medicine, we very much have been interacting with all of our stakeholders and understanding that there are very different perspectives and questions and priorities that are in place that are all part of addressing this complicated challenge. And so on the next slide, what we've done is we've put together some of our questions that help kind of identify what areas that we need to work with. And this is what also helps with our strategy development for our initiative. And so we've engaged with patient partners that were exclaiming, I thought my data was already being shared, and I've given permission for my data to be shared. Why is it not being shared, and what are the challenges there? We have institutions and hospitals saying, well, how do you ensure security and privacy? So if we want to help support efforts for sharing data, how do we do that in place? We have a researcher, a clinician saying, how do I make my data available and shareable to help move forward with these goals around precision medicine? And then we have a data user saying, requesting data, please. So I'm ready to do this. And how do we make this work? And so these are a lot of the underlying questions that we've been engaging with our stakeholders and our partners in the development of our platform, and being able to understand how we can unify the group through our initiative and move forward with implementing federated data learning and discovery. So I will turn it over to Ashley to dive a little bit deeper into that piece.
Thank you, Natalie. And yes, I will be diving a little bit deeper, but starting with a very high-level diagram on how the DHDP addresses the questions on the previous slide with the elephant. So hopefully it's not too blurry. I'm not sure why it's showing up like so, but I think it's still readable. So just to kind of go over this diagram, the DHDP allows users to share data and scale up access to accelerate research but like Natalie mentioned, it does it in a privacy-preserving way by not directly sharing the data. And this is what we call a federated learning ecosystem, since our diverse user base with the researchers, data scientists, and other end users, they cannot see the data, but they're able to trust that the data accessible in the platform is high quality and usable for machine learning purposes based on these aggregate statistics and visualization that they see. So in this diagram, you'll see on the bottom that there is the DHDP data provider who ensures the right individuals from the right organizations have access to the right data for a bounded period of time. And we also see on the top that we have the data user that scales up access to the data sets stored safely and securely at multiple sites for their analysis. And so the key principles we abide by to create this ecosystem includes a federated model and leading with the privacy by design approach, by leveraging DHDP's privacy protecting data governance framework and data science technologies that transform the way that we conduct health research. We also leverage from or adopt the best practices such as national and international standards that have been informed by our own Canadian experts and thought leaders as well. This will simply allow the DHDP to ensure high quality data and diverse data types is interoperable for various use cases. And last but not least, we also enforce the FAIR principles. So the adoption of FAIR principles allows data to be findable, accessible, interoperable, and reusable. And the DHDP will build a trusted data source by ensuring data is effectively managed and can be shared appropriately. Next slide, please. And allow me to set the stage for a use case that we have mapped out in collaboration with a data scientist from a research hospital in Ontario. As I mentioned, the DHDP allows data scientists to scale up their analysis. So in this example, we see a data scientist at a collaborative research organization has a mission to improve cancer care through better selection of patients for immunotherapy through the development of new predictive biomarkers. This is important as immunotherapy can be life-saving but expensive and may cause side effects or may not bring any therapeutic benefits for a subset of patients. So it's crucial that only the patients who are likely to benefit receive immunotherapy for their treatment. The challenge here is access to the clinical and genomic data of patients with immunotherapy within his hospital, his as in the data scientist, but he needs a larger data set to develop robust predictive biomarkers. And the use case goal here is to enhance cancer care by refining patient selection for immunotherapy with novel predictors, as mentioned, by scaling up access to the data. So through the DHDP, the data scientists can leverage the key functionalities that accommodate a variety of data provider specifications, so they're able to put the controls in place to share the data, but also support diverse user use cases. And then the data scientists can leverage the data set stored at multiple institutions and multiple sites to support their federated learning or their machine learning. Next slide, please. Altogether, the DHDP unites the AI institutes, hospitals, researchers, and industry to accelerate the medical breakthroughs through this federated learning ecosystem by linking and sharing of the real world data. So I like to say in a nutshell, the DHDP is a 21st century platform at the intersection of healthcare and AI by enabling data discovery. We see that in the first circle over here. Controlled data access, we see that in the second circle over here. And thirdly, the scaling of access to data for machine learning. And next slide, please. Now, allow me to briefly touch on why it's important in real-world practices in healthcare, such as with medical treatments for the application of machine learning. So here's a really nice visual I saw in another webinar and decided to include here because I like how it visually shows where the one-size-fits-all treatment approach fails and will consistently fail the healthcare system. We have our general patient on the top here, and this can be anyone in terms of demographics like age, gender, ethnic background, and this is something with a unique, someone with a unique medical history, as we each have our own unique health history and are impacted by things like the social determinants of health in different ways. So treating each unique patient with the therapy, as shown on the left side, without precision medicine, which is also the standard approach in traditional medicine, leads to an outcome that only benefits a smaller portion of the population while leaving no benefit or even adverse effects for the rest. However, on the right side, we see that precision medicine, that by applying precision medicine, by using patients' DNA tests, clinical data, and other pieces of critical information, can deliver tailored therapy for individuals or specific patient groups. And this is particularly important in rare disease because there's a massive benefit from sharing data for precision medicine by scaling access to the data that is limited for diseases in general, but also specifically rare disease. And now I will pass it back to Natalie to conclude.
Thank you so much, Ashley. And I think that example is a very powerful one when talking about being able to really help move forward with medical innovations and healthcare delivery and patient care in Canada. And that really underpins the impact of being able to have a technology that supports that type of activity. So our technical partners with the DHDP have the skills and expertise through the software that they've developed to make sure that there is secure access being enabled for data, which helps from an institution and data perspective, and data providers be able to feel confident that they can share their data in a way that can be used appropriately and in alignment with security and privacy considerations. And that enables the larger picture of a data view across the country, representing many Canadians, to be able to be leveraged in applications that develop models, such as the example that we gave within the demonstration in targeted immunotherapy. One piece that I'll leave you with is that, and this was actually point that was raised by one of my colleagues, Kelly Kerwin at the Terry Fox Research Institute. And I think it very much aligns with the work that we're engaged in being agents of change. And so here we are supporting a technology, a platform itself, a tool to help with change that's required in order to look at data across the country, to identify different components that can be used in order to support predictive biomarker development or changes in therapeutic approaches, to be able to support the ultimate outcome of precision medicine. And this is an important piece. This is our driving component that compels us within this work and this initiative, and one that we feel very passionate about. So thank you so much for having us join and talk more about the DHDP.
Well, thank you to both of you for presenting. I have heard about the digital health and discovery platform and had some idea, but didn't really understand the full impact of the work that you're doing. So I think it's amazing that we have this Made in Canada platform. And I'm thinking now with my advocacy hat on, do you see this as a best practice? Because to me, this seems like a global best practice.
Yeah, absolutely. I can jump in and say I do see this being part of a best practice moving forward. And in fact, it's in alignment with what's happening globally. We know that other countries across the world are implementing this type of federated platforms or technology. Some health systems are set up a little bit differently, so it's somewhat a bit easier to do that. Within Canada, when we're talking about our health systems, it's a little bit more challenging. But when you see that across the world, this is the movement that's happening, we're being able to do that here in Canada, and I think that that's a really crucial piece of work to happen to support Canadians.
And just to go off of that, thank you for allowing us the opportunity to speak, Sabrina. And yes, I definitely see the DHDP as definitely in the right direction. I onboarded just in May, and it was something that really excited me in my work because I'm fully supportive of the mission. And I see that this type of work is more so innovative globally, but within Canada, it's something that needs to be invested in and worked towards to achieve data sharing, to connect the data across the sites. And personally, I've supported electronic health record system implementation. I see how there are silos that are developed and how the DHDP can bridge that gap to accelerate machine learning in the healthcare space. Machine learning is also heavily researched, I would say, but much less deployed in actual hospital settings. And so I think this will help drive the gap between research and commercialization and fill that void where there's the valley of death, commonly coined.
Or maybe pre-COVID, there was a lot more hesitance to share data. And do you feel now, because all the data stays in that firewall, that there is a little less reluctance to use something like the DHDP?
Yeah, absolutely. And I would say that, one of the impacts from the pandemic is we saw firsthand how data information from various locations needed to be pulled together very quickly to get a full picture.
Mhm.
And I think that that was an important piece. And I agree with you that there was hesitancy before. I think there was just also a lot of kind of uncertainty around what would be the way that we make sure security and privacy are maintained. And I think that that's always been the hurdle. And I think it's a justifiable one. It's a very important one to be considered. And so when you're saying to a data provider, you don't have to move your data. It's within your systems. From a platform perspective, we call the data is de-identified. So only the data provider has the keys to who that data connects with, and that is never enters the platform itself. So that distance is something that really resonates with institutions and providers, making sure that that's in place, and being able to also have decisions around who has access to that data and how they can set the terms for that access. So within the platform, they, for example, can say they receive an application from an individual that wants to use the data. They can set what data can be used that aligns with consents. They can set the length of term. And there's ways that they can manage that access in a way that's very dynamic. And I think that that other piece is a really key component. And we're seeing a lot of positive responses and almost that exactly addresses what our concerns were right from the bat. So that to us is a great indication of sort of that movement in the space. And I think everyone is willing to participate because they want to collaborate and share. I think that that's the other side as well.
Yeah, and especially that it's a made in Canada platform too. I think that is really big. I really like that slide with the elephant, and I feel like, the blindfolds really gave it a great perspective. And as you were talking about it, I saw it sort of like, well, the DHDP is kind of like you're removing the blindfolds from all the different people so that you could see the elephant.
Yes, yeah, absolutely. I think that's a good take on it too, and I'm glad that you like that. That's something the team and actually it was Ashley who brought that image to the forefront when we were talking about how we communicate around the platform. And absolutely, when we start to talk about how you use the DHDP, it is being able to say, you know, this is how federated learning can work. This is how it can benefit from a clinical perspective. This is how it can benefit from sharing your data or leveraging the work that's been done. This is how it also leverages the contributions that patient partners have made within their data. And I think that that's a very important piece and component to it. So, you know, thank you for sharing your perspectives too when you saw that image on the screen.
So for me, I like I said at the start, like the AI piece of it is a little far removed from my understanding. But the way I see it now is that the DHDP is actually the AI that's being used in this space right now for Terry Fox Research Institute. Is that like a good layman statement to say about the DHDP?
Yeah, yeah, I was gonna say, go ahead, Ashley. I was gonna say you should probably respond to that because you have a great answer for sure.
Oh, sure. I mean, I think saying the DHGP is the AI for Terry Fox Research Institute is quite a broad statement. I would maybe change it up to say that DHDP is a data sharing platform that enables scaling up access to data for the machine learning. And just kind of tying back to your previous point on the patients trusting the clinicians to collect the data, to use it in the research and the analyses. I think trust is a big piece to putting that elephant image together and having the collaboration so the patient can understand what's going on with the technology development, not necessarily understand, but they see the steps that are being taken to enforce privacy and security of their data, and also just trusting the data provider between the data user, so understanding what the purpose of using the data is and how it's going to impact the patient in the end. I'm not sure if that really answers your question. I think I was trying to answer maybe a few of the questions at the same time.
No, that was great. That helped me better understand. So the AI concept, like I said, it's so complex and nuanced, but that helped me a lot. But you both had talked about the patients, and I actually did an interview with one of the patients that is part of the Cancer Center network with the Marathon of Hope. And I was just wondering if you could both speak a little bit about that relationship that you have with the patients and how they're involved in the work that you're doing.
Yeah, absolutely. Yes, and I saw her name on there, UN, and so yeah, absolutely. It's been my pleasure to have connected with her when we were first forming the Marathon of Hope Patients working group well over a year and a half ago. And so absolutely. So from a patient perspective, and integrating our patient partners within the work that we do, it's a key priority. And one of the things that the patient working group has been doing for Marathon of Hope Cancer Centers Network is helping in the formation or informing the work that's being done with developing the data set, the gold cohort, which is a really important piece of work because it's talking about creating what they call a gold cohort, and it's a resource of data and information that supports cases across cancer types and across the country. And so it's a very important piece. Where we are with our platform development is that now we're engaging with our patient partners, and we'll be expanding a patient working group that's working with the project specifically to help inform what we call our patient, right now we're calling it our patient portal, but it's going to be able to expand information about how the platform's being used and what data is being used to help inform patients about the work that's happening with the data. And I think that that's a really important piece in conversations that I've had with our working group. One of the pieces that sometimes doesn't happen is that feedback loop back to patient partners around data and that what's been contributed in a study. And it might be, oh, here's the publication of the study, which is great, but then also there's still a lot of information. And what we want to enable is a mechanism to say, data that's been contributed or used through the platform, here's what types of research are being done with that data. Here's the direction of that research. Here's questions that you might want to ask around different clinical studies that are happening now, or different questions that you can ask about genomes and sequencing and clinical data and how they're being paired together. And so that's a key piece of our initiative, and one that we'll be embarking on now that we have our minimum viable product ready to be deployed. So I'm really excited about that work to come forward, and I think it'd be quite impactful, and I'm very grateful for all of the contributions from patient partners that have been involved along the way. It's invaluable, and we would not be able to do anything without that contribution.
That's such an important piece, and I'm so happy to hear that you're working on that. Ashley, did you want to add anything to that part?
I think I wanted to leave the floor to Natalie because her work has been heavily involved with the patients and the MOHCCN network previously. So I think she captured she pulled the words out of my mouth for anything I would have wanted to say.
All right, so just the last question for both of you. What excites you most about DHDP short-term and long-term?
Go ahead, Ashley.
It's a big question. I feel like I need to think on it for a couple of days. But I think just straight off the bat, I'm very excited to see federated learning use cases with the DHDP minimum viable product and with other projects, so we can really dive into the impact from A to Z. So starting off with ingesting the data with best practices and a standardized model, all the way to this machine learning model has this level of accuracy thanks to the DHDP allowing me to scale up my access to data and sharing the data and stimulating the collaborations. And I'm more excited to see the machine learning models developed in being commercialized and being deployed, and just seeing the research go to implementation. So maybe repetitive to my previous answer, but I think that's the most exciting part of the DHDP.
Yeah, and I'll add about, I'm excited for the change that can come through the use of the platform. So I think Ashley described very perfectly these a short-term output and outcome. Once we're able to see exactly the use of the platform, I think, Sabrina, you had shared about AI and sort of what that would mean in the use. And sometimes that's not necessarily also very clear, because this is an opportunity for data scientists and researchers and clinicians and patients to now say, oh, we can now share. What can we do? And that innovation is so exciting. I firmly believe that there are all these ideas that have been percolating through studies and work, and now this is going to be the catalyst to help propel those forward. And that's really exciting, because I think it can have some significant impact and change. And so I'm very privileged to be a part of this work and hopefully have those outputs.
Yeah, it's so exciting. And I'm just gonna repeat myself, but I'm so glad to see that this is happening in Canada. And for me, that's maybe the most exciting part of all of this. But I know I said it was gonna be the last question, but I feel like as an advocate, my role is to help move things like this forward. And I know that other advocates who are going to watch this are like, they're going to be 100% on the DHDP bandwagon. And what can we do to help you?
Well, that's a fantastic question, and I really appreciate that offer too, right? I think so. Right now, we're going to be deploying the platform in across the country. I think that it's really important once we deploy the platform to be able to drive these use cases and to understand how we can look at different models that are being developed. And these use cases can come from a question. So just like we shared on the screen there about the question there, what would be a question that you would want to see answered clinically? And how can we then support a project to do that? I think that that piece would be really helpful. I know that there's always opportunities to become a member. We have a lot of information on our website. We will also be putting out a call, as I mentioned too, with patient partners that are joining our initiative. So I think that that would also be a helpful way to participate, but also just engaging with us with ideas and suggestions. I think we always welcome that. I think that's also been the strength of those that have participated in the DHDP thus far. They've come together with a passion and an interest and fantastic ideas. And I think we wouldn't be where we are today without those supporters and champions. And so it's always helpful to be able to have more individuals involved. We would really welcome that opportunity.
Yeah, well, you talked about the clinical question too, but I think there's also that policy question that we can
Yes.
ask, which,
Yes.
you know, could help move things along as well.
Absolutely. Absolutely. Very important.
And I think this is a great question to end off with because it allows us to open the floor to anyone watching this video to contact Natalie or I. I believe Natalie's email is on the dhdp.ca. That's the DHDP website. Or you can reach out to me. I think I'm easily findable, maybe on LinkedIn. So I think just to answer the question, Sabrina, we're always open to engaging with new individuals interested in the DHDP and providing an overview for them, and then opening the floor for a conversation about what kind of collaborations we can explore. Sometimes that's a collaboration with a potential end user interested in contributing their data or doing an analysis, or it can be a collaboration like what spurred out of my conversation with Canadian Breast Cancers Network, which led to this opportunity for us to present today.
Yeah, wonderful. Well, I can share that information too with the video. So I'll make sure that that is available. Thank you so much. This was such a great discussion. I appreciate your participation in Precision Medicine Awareness Month, and happy November.
Thank you so much. It was great to connect with you today. We really appreciate it.
Well, I appreciate you guys.
Thank you so much.
Thank you.
Take care.